Question two, how does arthritis cause bunions and what are the non-surgical treatments? Dr. Feldman, you want to answer that? Talk about arthritis?
Yeah, actually, I just did a comment to the group. So because a bunion is actually a joint imbalance. Again, let's use that knee as an example. People would understand that if your leg comes down and your lower leg angles off, so your knee is distorted, it's pretty obvious that your knee is going to become arthritic. You're going to wear out one side of the joint over the other. The big toe is no different. When the toe is angled or deviated, you're going to wear out one side more than the other. Once the joint gets worn out, that's arthritis. Um, there's different levels of it. The picture that you have on the upper right of the screen, Don, that's really bad arthritis. That's almost a fused joint because there's no cartilage left. There's a lot of extra bone that's formed. Because once the joint deteriorates enough and you're still trying to use that joint or stuff that foot into a shoe where the toe is being pushed over or doing exercises that force motion through the joint that's the joint can't possibly use that motion, then the cartilage is going to wear out. So most long-standing bunions are going to have arthritis either at the joint level where the bunion is or the joint behind where in some of Dr. Saviet's pictures where the screw and the staple. And oftentimes it's the instability where your arrow is now at the joint behind that allows the bunion area to get out of position that creates the arthritis in that joint. So we always look at arthritis when we're assessing bunions, but they're part and parcel. They coexist.
Perfect. Perfect.
And before you walk away from that, sometimes there, obviously that's an end stage joint. There's nothing you can do but finish the job that nature has completed there. There are times when you can do a bunion surgery and fix the bunion, but also what's called decompress the joint, where you basically make a little bit of extra joint space in there. And that can preserve you and keep you away from a fusion for an extended couple, sometimes 5 years, sometimes 10 years, sometimes forever. So it's worth considering some of the time that, sometimes you should strike while the iron's hot to correct a bunion before arthritis gets there.
Mm-hmm.
I'll answer the second part of that question too, the non-surgical treatments. So in arthritis, and there's a huge spur of bone, sometimes we just go after the big spur of bone because in some people it can actually create sores in the skin. It can create impossibility with wearing shoes. So there are occasions where we'll just take a very simple approach and smooth something, but then you want to manage the arthritis. So arthritis is a joint that doesn't move well. So if you understand that and you're able to not force motion through that joint, then you're going to feel better. So that means getting into the right shoe, maybe making an orthotic that stiffens up the joint from the outside instead of the inside with a plate and screws. But it's all about trying to understand what bothers the foot, what bothers the joint, and seeing if there's a workaround so you can still do the things you want to do in life without bothering the joint. Simple things that nobody thinks about would be push-ups or gardening or going down the stairs. These are things that are really hard on big toe joints that don't bend. So it's not like you can't garden or you can't do a push-up or a plank or walk down the stairs. You just have to maybe change how you do it. There's always ways to figure it out or work around it. It just, they might not be intuitive. And sometimes we just have to point it out.
Perfect.